Good morning. We are here in the Center of Sleep Medicine, San Raffaele in Milano, and we are with Professor Luigi Ferini-Strambi, which is director of. Good morning, Professor. What does the center do?
In our center, we usually evaluate a lot of patients with several sleep disorders, including insomnia, excessive daytime sleepiness, parasomnia. Parasomnia means, patient with problem of sleepwalking, sleep bruxism, and other phenomena that we can observe during the night. But I think that one of the most important problems is habitual snoring and patient with obstructive sleep apnea.
How problematic is the pathology of snoring? What damage can it bring?
I think that simple snoring is a very important problem in terms of epidemiology. We can say that around 25% of general population may have a problem of snoring, but I think that we have to remember that there is a continuum from simple snoring to obstructive sleep apnea. And I think that these pathologies are very important because there is a very important impact on quality of life and also on the health. Why? We have to remember two things. The first thing is that with habitual snoring and obstructive sleep apnea, you have a sleep fragmentation during the night. So this means that you have a lot of awakenings during the night, and the final results in the morning, you feel not better. You feel very, very tired. And at the same time, you have a problem also of excessive daytime sleepiness, and this is a very big problem. The second problem is the very important impact on cardiovascular system, because we know that during the night we have the lowering of cortisol, and it's very important, this aspect, because with the very low cortisol you may observe a decrease of blood pressure. But if you have the problem of habitual snoring and obstructive sleep apnea, you cannot observe this lowering of cortisol, and your blood pressure remains very high also during the night.
What is the foundation of the positional theory and what are the results?
Positional therapy is very important because we know that about 70% of patients with mild to moderate obstructive sleep apnea and snoring may have a problem just in supine position. So if you avoid this supine position, you can solve your problem. And also in very severe patients, you have 30% of patients with very severe obstructive sleep apnea in which you can observe just the problem in supine position. And again, if you can avoid this supine position, you can solve your problem. So I think that positional therapy is a very important therapy for this patient.
The positional theory can be applicable to every case.
I think that we have to remember that usually the supine position is much more important in patients with not very severe obstructive sleep apnea. So this means that in a patient with very mild form of snoring and sleep apnea, you can solve your problem by avoiding the supine position. And the problem is that we don't have right now the long-term effects of this therapy, and we have to wait, I think, few studies that are coming right now that we can clarify exactly what is the results after 1 year, 2 years of this treatment.
Thank you, Professor, for this valuable information you have provided. And we start to use this information to assume a correct position during sleep.